have reflux symptoms, plus any of the following: snoring, witnessed apneas, waking up gasping, morning headaches, daytime fatigue, dry mouth, chronic throat clearing, hoarseness, nighttime cough, or a sour taste at night, you should at least have the reflux apnea connection on your radar. And if you already have diagnosed sleep apnea, but your throat symptoms are terrible, or you are still having lots of nighttime symptoms, reflux may be one of the missing pieces. Personally, I frequently refer patients in my clinic who have reflux-like symptoms for sleep studies. A good proportion end up having OSA and start to use a CPAP. When I see them back in clinic, they invariably rave about the improved quality of sleep and increased energy levels.